One last question, at least from myself. In the earlier testimony today, well, let me just say there have been a lot of recommendations made to this committee on how things can be improved, and I would certainly be curious to know how the VA is digesting that and how they're responding to it. But there was one, I think, compelling recommendation today to, before we move forward with a major fix to this situation, that we should first do with an outside consultant a cultural assessment within the VA. And I'm just wondering, what your reaction is to that, what your response is to that recommendation to this committee.
So the answer is absolutely, but more. Yes, the cultural piece is crucial, but culture is established by leadership. I take that very much to heart. The organizational structure and design was part of that discussion, and again, absolutely. And we have been over the past several weeks meeting with a number of people who work in this area with expertise in this area. Absolutely agree it needs to be done. We can't redesign it ourselves. We need the input, and I've been having a number of conversations with, for instance, folks at Kaiser. How does Kaiser's organizational structure seemingly to work well? How does Mayo's structure work well? How does Geisinger's structure work well? We need people who can see across those systems, like Mr. Collard does and can, and bring that shared knowledge to bear to us. So yes, we definitely plan on doing that. We will do it expeditiously.
Thank you. Thank you.
We will include the veterans and the veteran services in that discussion as well, by the way. So.
If I can, just in closing, ask one question. In testimony that you presented to this committee in February of 2013, you stated that the Pittsburgh VA healthcare system's copper-silver ionization system may have failed to consistently prevent Legionella growth. Do you recall that testimony? Okay. But in a December 2012 VA report, VA leadership was made aware that it was poor record keeping, lack of oversight and documentation, failure to test the hospital water's pH level, and other problems were at the heart of Pittsburgh VA's Legionnaire's disease outbreak. So now we know that it has led to at least 6 preventable deaths at that facility. So explain to me how you could testify to Congress contrary to something that had already been delivered.
So I was not aware of that report at the time I made that testimony. And I apologize.
Are you aware of the report today?
What's that?
Are you aware of the report today?
Yes. So,
has anybody been held responsible for writing your speech or intentionally misleading the Congress?
Well, I don't know that anybody intentionally misled. I don't know where that said report was given to senior leadership. I don't know the trail on that report. And in fact, I was made aware of it only relatively recently. And so somewhere in the traveling of information, it didn't get widely distributed.
So
I apologize. I don't know the answer to that. But
has the person that wrote your testimony been held accountable now that you know about the report, and it does in fact contradict your testimony?
Well, I don't know that the person who wrote the testimony was aware of it at the time either. I don't know what it means that central office was aware of it. So I apologize. I don't know the answer to that. But there was no intent to mislead. I assure you of that.
But we now know your testimony was not in fact true.
Well, no, the testimony is true. It's not complete, but it is true. You know, let me put a reference point on it. The CDC came in. They took extensive water samples. And in those water samples, in fact, the copper silver iron levels were at manufacturer's instructions levels, and they grew Legionella out of them. So we know that in water samples that had appropriate copper silver iron levels, it failed to control Legionella. And that's not happened just in Pittsburgh VA, it's happened in other hospitals. So
Does it, I guess my question is, this is, and again,
Yeah.
I mean, this is pretty critical, but does it bother you that you testified to something, there was a report that differed from your testimony, and you were not provided that information?
It bothers the heck out of me, yes, sir.
Okay, all right, that's
Absolutely.